Malunion and the non-union. So malunion is the healing of fracture in a deformed position without a satisfactory alignment. So either it can be in angulation, rotation, or shortening. Causes of malunion are inadequate reproduction and inadequate mobilization. Then there's a loss of position after cast removal and an unstable fractures. The types of deformity either it can lead to angulation, that is varus or valgus deformity, rotations, or shortening of the limb. Then the clinical features, there will be a visible deformity, there is a limb width discrepancy that can be seen, altered joint mechanics, there is functional impairment. The pain is not associated with it, or abnormal movements are also not associated with malunion. The X-ray findings, the fracture is united, it is healed in an abnormal alignment, and the joint shows early arthritic changes. Management: if it's a minor deformity and it's a child, then remodeling is possible. Significant deformity, then osteotomy should be done, and internal fixation. Then it is a established arthritis, arthroplasty should be done, and if there is a limb length shortening, then limb length uh, extension or lengthening procedures can be used. The examples of malunion, they are given by this mnemonic MISC. So I stands for intertrochanteric fracture, S stands for supracondylar fracture of the humerus, and C stands for the clavicle and the Colles fracture. The next is non-union. Non-union is where the fracture has failed to unite after the expected time. So generally, after 6 months, if the fracture does not heal, then that means non-union. Now the types of non-union, there are two: atrophic and hypertrophic. Atrophic, where there is no callus formation and bone ends they are seen to taper and are osteoporotic, while in hypertrophic there is abundance of the callus that is seen and there is no bridging, that is gap is still visible. Then talking about the causes, so there are patient factors or fracture factors or treatment factors. So patient factors is nothing but old age or any systemic illnesses, malignancy. Then fracture factors, they are going to be the distraction, soft tissue interposition, bone loss, infection. And treatment factors are inadequate immobilization is the most common, followed by inadequate reduction. Then common sites, the common sites are given by this mnemonic flutes. So F stands for the neck of femur, L stands for the lateral condyle of the humerus, then the U and the T stands for the lower one third of the ulnar, the tibia, and S stands for the scaphoid fracture. So flutes is the mnemonic. Then the clinical features are there is a pain at a fracture site, there is abnormal mobility at a fracture site, there is no bone tenderness. The X-ray findings are that if it's atrophic in nature, the bone gap is seen, no callus is seen. While in case of hypertrophic, there is an elephant foot sign that can be seen because of abundant callus. Then the treatment. So treatment, if it is going to be hypertrophic non-union, then in that case stable fixation is required with the help of a compression paste and the intramedullary interlocking nail is required. In case of atrophic non-union, then with osteoporotic vein should be cut, there should be decortication along with a bone graft should be used for stable fixation. In case of infected, then debridement should be done, antibiotics are given, and external fixation with Elizardo's technique. And then if there is a deformity or shortening, then Elizardo's technique that is used, that is called as distraction osteogenesis. Here in Elizardo technique is a ring fixator, there is a compression at the non-linear side and can correct the deformity at the lens simultaneously. What are the key differences between malunion and non-union? In malunion, there is obviously union that has taken place, while in non-union there is no union. Mobility is not present in malunion, mobility is present in non-union. Then the pain is minimal, pain is present on use in case of non-union. In X-ray it shows the heel deformity, and non-union shows a gap. The management of malunion is osteotomy, corrective osteotomy should be done, and in case of non-union, it's the stable fixation and grafting that should be done.